Tobacco, when we refer to tobacco, it's a cluster or group of plants that are biologically called tobacco nicotiana. And these products contain nicotine that is very, very addictive, and other substances like polyaromatic hydrocarbons. We have flavoring agents, we have benzene, formaldehyde. All these substances are in tobacco, so they are either processed as other tobacco products, and the trending or the newer forms of tobacco products we have are the shisha or the hookah that is popularly being patronized, particularly by our youth. And then we have the electronic nicotine delivery systems or the vaporizers. So these are a cluster of products. So per our law, the Public Health Act 851/2012, the Part 6, it defines this as the plants and its extracts. But there are newer forms that are now synthetic or chemicals, that, like the e-cigarettes and the vaporizers. And these are all tobacco products, and all these have damning or consequences on our health if patronized or if smoked. So these all fall under the products that we regulate in this department. The products, the tobacco products, either the regular combustible ones, the cigarettes, and the non-combustible like the vaporizers, they all contain nicotine. And the nicotine is a substance that causes the addiction. So what it does is you can take in small quantities for the euphoria or for the pleasurable effects. That's why they smoke. Then after a while, you develop tolerance to it. So you'd have to be increasing your quantities. And after a while, you would even want to stop or you want to quit because it will be having dire consequences on your health, but you cannot. That's when we say that you've become addicted to the substance and you need psychosocial support to quit. So the product affects from your head to your toes, every part of your body. It causes cardiovascular diseases, heart-related diseases. It causes tooth decay. It can affect your internal organs, your liver, your kidney. It causes infertility. So there is actually no health benefit when the product it's being used, whether you chew it, you smoke it, or it's a snuff. There's no health beneficial, and there's no safe form of tobacco, and it has very dire consequences. In fact, it affects even the non-smoker, what we call the passive smoker. So if you happen to be in the presence of somebody smoking and you just inhale it, you are at much danger as the person smoking it. That's why we have laws that has banned public smoking, so that if you want to patronize a public facility and there's a non-smoker, the law allows that it should be done in a DSC so that the non-smoker is not affected. So the smoke affects every part of your body. A vulnerable, like an unborn child, a pregnant woman smokes. We have this syndrome that we call sudden infant death syndrome. The child will be born either premature or in their first to 5 years, they may not live because their lungs are not properly developed. If they even live, they are predisposed to getting asthmatic attacks or other respiratory infections because of their non-properly developed lungs. So it has all these dire consequences, and because of that, even though we regulate the product, we also do intensive public education to dissuade people from even being initiated into tobacco use. Yes. So it's one of the leading cause of preventable deaths, disabilities, and we have that about 75 people or men die weekly from tobacco use. About over 800,000 people die annually in Ghana. 8 million people globally, and out of these 8 million people, about 1.2 of them will not have smoked. They will be passive smokers. They will just have been in the presence of people who smoke. So the statistics are gory. What we have in country now is the combustible or the traditional smoke tobacco product is rather on the decline. These are the newer forms or the trending ones, like the shisha is what is on the increasing now. And in fact, females who traditionally wouldn't have smoked find this trending. So we realize that female youth are patronizing this, and our education is targeted at them, telling them that these are not safe forms of tobacco, even though they are flavored, and the mode of use, they say it passes over water. There's this misconception that the shisha is safe, but these products are non-safe. They are all as dangerous as the regular combustible one. 2-3 years, yes, I don't think we have that now. But the public education that we do in the schools, we go to the preschools, and you have as young as 7, 8 knowing what it is. And some have families that smoke, so they are exposed to it. They may not themselves be smoking, but this motivates them to get into the habit of smoking. So 2-3 years, no, I'm not sure that's possible. But as young as 8, 9, 10, these ones are all exposed to tobacco use in the country now.
Yeah. Just by the way, I realize some parents do send their kids 2, 3 years or 5 go and light this cigarette. That's where that particular
the practice is picked, yes. But the law actually protects the young. So there's minimum age restriction where parents are not, or adults are not supposed to expose children to tobacco use, send them, allow them to sell. So if even somebody is selling to a minor and you are caught, you'll be found wanting with the law, because you are supposed to take IDs to ensure that they are above 18 before you can sell to. The law allows that above 18 they can be sent or exposed, but below they are not supposed to. The law protects the youth against being exposed to tobacco use. I think that to a large extent there's an absolute ban on tobacco advertising, promotion and sponsorship. So you do not see the celebrities advertising like they do with alcohol. In fact, even to alcohol, we've been able to stop them with our guidelines, and now you do not see them advertising. We've been able to even restrict alcoholic beverage adverts to 10 p.m. Yes, but for tobacco, those are absolute bans. So if you are seeing any role model or any celebrity, then it's criminal, and you should just draw our attention to it. When we see giant billboards mounted by even real estates doing adverts with somebody with a cigar, we find them. We pull it down. Thankfully, the law allows that you do not have to advertise, because we know advertising, it will just lure these young ones, mislead them and motivate them to start or be initiated into using the tobacco. So we have a tobacco law that has banned this, and you don't see them. The only issues we are having now is sometimes social media presence, but our staff are there and monitoring 24/7. Once we see them, we bring them to book. Once we see that a public facility is advertising, even a neon sign, shisha for sale or shisha, no, we'll just pull it down and fine you. And a lot of monitoring is ongoing, that because we know that it stays on the minds of especially the young ones when they see the people they admire involved in these things, or they see giant billboards being mounted with these things, then they flow and they are able to indulge in these things. But thankfully for tobacco, we have that on grasp, and there's no advertising. You bear with me, I don't know how old you are, but when we were growing up, we had Embassy Double Do. All the beauty pageants were being sponsored by these ones. You don't have them anymore. So there's another law that allows that if you would do movies and show scenery of tobacco use, probably it is not advertising, but to tell the moral aspects of it, to tell the dangers involved in using tobacco use, then you would have to subtitle and write these negative effects under the movie. That's what we are seeking to do now. The law allows that we censor them and classify them. So we are collaborating with the agencies that do the movies, Ghana movie industry, those who do censorship, the classification, that we can be able to enforce this aspect of the law as well. So that going forward, the movies that would air scenery on tobacco use, because you have movies that will say they are negatively or telling people about the dangers associated with it, not to say they are advertising it, which is against the law. They would have to subtitle and negate these effects that they are flaunting in the movie, and all that the law allows that we should enforce. So that's what we are doing now. Going forward, if there are movies, such movies, we are collaborating. You know, this is multifactorial. We don't produce the movies, so we have to engage the people who produce the movies, who do the classification, so that we can see that this is enforced to the letter. So we do not have a lot of tobacco bats like you see in the developed world, but even no matter how small it is, it ends up in our oceans, our sea bodies. We've mentioned that it contains a lot of pollutants and chemicals. They would also, our water bodies, that we are spending more money to ensure that by the time it gets to our taps, a lot of chemicals have gone into it and they've been purified. These bats and other chemicals, when they find themselves in it, will pollute it. They also pollute the bodies or the fish, the other things that live in it would be affected by the chemicals in the bats. Even though we don't have a lot like it's in the developed world, we've started engaging in doing public education on the effect it will have on the environment. It's not just the smoke. The other thing is sometimes we've known that some of the fires that have been caused in markets and other places like bushfires and market fires have been started with deposits of cigarettes that have been left and there was still fire in them. So these are the effects it's having on the environment. This year, the theme on World No Tobacco Day was how it affects the environment. So we are engaging other stakeholders like the EPA, who do a lot on environment, so that the country will think about it and get a strategy going forward, and so we are not affecting our environment negatively. It talks about prohibition of a ban of smoking in public places. Smoking is banned in all public places, all working areas, all schools, bars, markets, all those places, except in a DAC. All places of collective use, except in a designated area. So we have specifications of a DAC that we've sent out to the facility owners, and they are complying to that. And we routinely do monitoring to ensure that these are complied with. Then the product itself has to be registered. You would have to put on health warnings or graphic health warnings, something to tell the smoker that what you are putting in your body is dangerous. Don't, because we know that people will smoke anyway, so you'd have to protect them. And all these graphic health warnings, which are peculiar and have been pre-tested in the country and our people appreciate and understand the effects, is what we put on our packs. We ensure that what is coming into the country has the packs. We ensure there's no illicit entering the markets, because we are saying there's no safe form. What we've even seen and gone to the lab, we are telling people they should stop smoking. How much illicit? It means other substances may be in it, and if it doesn't undergo regulation, what are people smoking into their bodies? So we are checking illicit with the help of the police, customs. We work a lot with civil society organization as well. In the communities that we do public education, they are already with the community, so we partner with them to do a lot of public education. And this public education do not end in only the schools. We go to churches, we go to mosques, we go to market areas, we go to derbys. Everywhere we are invited to, we have this dual role of letting people know that these products are not safe. I mentioned that the shisha is catching on with the youth, so we have targeted messages for our youth in all the schools. We are doing peer groups where the children themselves, or after we've left, take it up. And then recently too, we've come up with a song which we call Debbie, that you mentioned role models. So when we've gone to places to do public education, they will tell us we didn't bring any star. Sometimes it's boring, but so we've put these celebrities together, done a music on substance abuse, including tobacco, alcohol, all substances of abuse, and then tramadol that we had on our hands, so that this is trendy. It's been put on all our social media platforms.